Hi guys, today I wanted to discuss breast pain, also known as mastalgia. First off, as a woman, I think 75% of our breast pain probably comes just from our monthly cycles, but there are some other possible causes, and I'll quickly go through these. Breast cysts. Certain medications like the pill and hormone replacement therapy and antidepressants can also cause breast pain. Breast surgery obviously causes issues. Costochondritis, which is an inflammation between your ribs and your breastbone, and obviously you would have arthritis then. Fibrocystic breast changes, where your fibrous tissues in your breast as well as the cysts can cause pain. Mastitis, which is usually when you are breastfeeding, you could get mastitis. Poor fitting bra, breast cancer. Most breast cancers don't actually cause pain, but if it's an inflammatory cancer, it can cause pain, and depending obviously where the tumor is, it could cause pain. Neck, back and shoulder sprains can actually cause some discomfort in your chest because your muscles and obviously your nerves and everything is all connected, so it's just a distribution of just pain, I guess. You can get chest wall pain from a pulled muscle, and I think that's about it. But most women get breast pain during their monthly cycles, when they're about to get their period, and sometimes when they ovulate, they can feel a change in their breasts. In my situation, I don't have breasts. I had bilateral mastectomies 10 years ago now, over 10 years ago. And so obviously I don't get any monthly changes in my breasts. I only have the implants, and they're under my muscles. Obviously, right after my surgery, I had scars going from the center of my chest across to under my arms. So I had, obviously those scars needed to heal, so there was some itching involved with the cuts, and obviously the nerves, they took over a kg of breast tissue, so there was a lot of nerves that I obviously lost, and obviously there was nerve damage, so they're quite numb over the top of my breasts. I don't have, just TMI, but I don't have any nipples. They did offer to do a reconstruction of using other tissue from other parts of my body to create nipples. I just didn't see the point. So, and then also I just kept on thinking it just added more in terms of healing that I would need to go through, or just later you could get complications, and I didn't see the point. I just didn't want breasts. I didn't want the breasts that I had. And so I just had the straight up scars going across my chest. And then 5 months later, when they took the tissue expanders out from under my muscles and then put in the implants, they did a small cut incision along the scars that I already had. So I didn't get any new scars. And they were a little bit smaller, and they were easier. They healed up. My scars are really healed well with that. Obviously, while I was going through the process of having the tissue expanders inflated to create the space for the implants under my muscles, there was some mild aches as my muscles had to stretch, and obviously my skin had to stretch. So there was those pains. They weren't painful that I needed to really take any medication for it. Then I would say about a year after the implants were put in, I remember getting this like an itching sensation, and it was really annoying because it wasn't on my skin, or like it actually felt like it was around the implant itself, and you can't get to it, so I couldn't scratch it. I would just scratch the top of my skin nearest to where the sensation was coming from. Didn't really help, but it was the most annoying, and you couldn't take anything for it because it wasn't like a pain, it was itchy. In about a year and a half after my surgeries, I started karate. So obviously, you're doing push-ups and you're doing quite intense training, as well as doing high intensity training at home. So push-ups, pull-ups. So I was always very aware and conscious to be very cautious of putting too much strain on my chest muscles, as well as shoulder and neck, just to make sure I didn't injure myself unnecessarily. Then, I did karate and the training for about 2 years. I stopped about 6 years ago, and I didn't really notice any issues with pain over those periods. And then about 4 or 5 years ago, that is when I started noticing I would get these, just like an ache in my chest, and then sometimes I would be like quite a sharp pain, and it'd be really noticeable. I would actually start massaging my chest wherever the pain was, because nothing would take the pain away. It was just strange. I would try and think, okay, have I lifted something heavy? Did I do something? And there was no real cause as to what could cause this pain. And like I said, it was different. Sometimes it'd be just a dull ache, and other times it'd be quite a sharp pain. Most recently, I haven't gotten as much pain around my breast as what I've noticed before. But right now, I'm getting a new sensation, which is not painful, it's not uncomfortable. There's definitely there's a sensation. And when I chatted to my doctor about it, she said it's the medications that are kind of trying to detox, get obviously the poisons or whatever's around my breast, or around the breast implants. It's obviously trying to get rid of those things, because it kind of feels like like something's draining away from the area. So I'm positive that that's happening, because it means there's toxins getting out of my system. It's not nice knowing that there is obviously toxins there, and it was really prominent, obviously, around my implants, because that's the only place I actually felt that kind of sensation. So that's the only pain I'm feeling at the moment in that area. Like I said, the previous sharp pains and the dull aches, they were very inconsistent. They would come and go. There was no real explanation as what could have caused them. And obviously, as always, thanks so much for taking time to watch this video. Please share this with anyone you know who's got implants and is experiencing breast pain, and it's like an unexplained breast pain. Something to be aware of is implants are placed in different places. Mine are under my pectoral muscle. Some implants, because mine were reconstruction after bilateral mastectomies, where other women might have implants on top of their muscles, and then you obviously, after mastectomies or lumpectomies, and then you obviously have women who just have implants in for augmentation purposes, or so they still have all their natural breast tissue as well. And in those situations, obviously, they'll have their hormones affecting the pain that they could be experiencing. Thanks for watching.